For patients with minimal degenerative changes, they still have very healthy looking discs, but they have a disc herniation pushing on the nerve, we can do a disc replacement, which is seen here. And what this does is it mimics the natural movement of the disc that we are taking out to take the pressure off the nerves. What that helps with is decreasing chances of the discs above and below going bad or having revision surgery. Typically, this is more for younger patients because they have less degenerative changes. Most of the patients I put these in are usually late 20s going into their early 40s. It could be an injury, motor vehicle accident, work injury, and that could just cause enough trauma to where the disc herniates and pushes on the nerve. Other than that, they don't have any other real neck or degenerative issues, and so we just try to treat the exact problem. The actual disc replacement itself is basically two metal plates that kind of bite into the bone on either side, and then there is a plastic disc which can move forward, backwards, and side to side to mimic the full 360 degree or 3-axis range of motion of the disc in the neck. Going through the front of the neck seems kind of scary, but typically it's actually way less painful than going through the back of the neck, or even for lower back surgery going through the back. We're not cutting any muscle, we're using natural muscle planes, just moving things aside gently, and typically patients tolerate that much better post-operatively than they do when we go through the actual posterior aspect of the spine. Usually keep in the hospital overnight. If they're doing really well, let them go home the same day. Gentle range of motion and just no lifting over 10 pounds. That's just to allow the bone to kind of start growing into the metal end plates to help seat it better. At 6 weeks, we'll get x-rays in the office, one to check motion, and two to make sure that the implant has not loosened or become unstable. And if it's looking good, I'll let you start increasing your activities tolerated.